Good morning, everyone. I am Varsha Shrivastava from Bladder Wellness Team. I hope you all are keeping safe. Please vaccinate yourself and wear a mask when in a public place. Today we are here to discuss about overactive bladder. Overactive bladder is a frequent or sudden urge to pass urine that may be difficult to control. The condition is common and distressing and may have a huge impact in the quality of life. So, in this week, let's unite to raise awareness about the issues related to overactive bladder and its impact in the life of people living with it. To throw more light on the subject and guide us on what's right for diagnosis and treatment of overactive bladder, today we have with us Dr. Onkar Singh, sir. It gives me an immense pleasure to introduce Dr. Onkar Singh, sir, to you all. Dr. Onkar Singh is a consultant urologist, andrologist, and kidney transplant surgeon at Shriman Super Speciality Hospital, Jalandhar. Sir has a rich experience in the field of urology and carries out the treatment with utmost precision and efficiency, ensuring that the patient's health is in safe hands. Sir, it is a pleasure to have you in our show. We welcome you.
Thank you so much, Vashaji. I would like to thank Bladder Wellness team also for arranging this talk because I personally believe that this overactive bladder syndrome, it is a serious health condition, although it is, and yet it is, underdiagnosed and undertreated, and it definitely needs a light on.
Definitely, sir. So there are many things that we would like to know about overactive bladder. So first we will start with its meaning. What is overactive bladder?
So, Vashaji, the thing is, as the name explains it, overactive bladder means when your bladder becomes overactive. Basically, this is a problem which leads to a variety of symptoms. Of these symptoms, the most common ones are when the patient has to get up multiple times in the night to pass urine, which is, we call it as nocturia. And the other symptom, very common symptom, is frequency of micturition, which means that the patient during the daytime also has to pass urine multiple times, has to go to the loo to pass urine multiple times. And thirdly, there is a common symptom which may or may not be there is a leakage of urine. And this leakage of urine, if it is there, we call it as overactive bladder wet. If it is not there, we call it as overactive bladder dry. But let me remind you again that this overactive bladder is a serious health condition, especially more common in females.
Okay. So it is a serious health condition and we cannot take the chance of ignoring it. Okay.
Right.
So, sir, as you have mentioned that females are more prone to this particular problem. So after which age, what age they will have the chance of getting the problem of overactive bladder?
Usually after the age of 40, with the age, the chances of having overactive bladder syndrome increases. But definitely after the age of 40, it is very common, because after the age of 40, there are a lot of risk factors which come into play for this problem to happen.
Okay. So, sir, what can be the underlying cause behind it? Why does it happen?
There are various causes actually. The thing is, among the causes, there are certain treatable causes, some non-treatable causes. If you go priority-wise, number one is the health style issues. For example, if the person is taking a lot of liquids, he's taking such diets which increase the production of the urine, or he or she is taking some drugs which increase the production of the urine. This may lead to the patient going to the loo again and again during the day or the night. Then there are certain urinary tract infections, especially the low tract urinary infections, including the bladder and the urethra, which can increase the overactivity, the sensation of the bladder, which can lead to the symptoms. Then if the patient has some sort of anatomical problems, for example, anatomical or the other pathological problems, for example, stone disease or some bladder tumor is lying in the bladder or in the urethra, it can lead to overactive bladder symptoms. If you talk about the males, in the males, a very common problem is prostatic enlargement, which happens after the age of 40 to 50 years. This leads to the obstruction of the urine flow from the bladder out. So it leads to the overactivity of the bladder over a longer period of time. So in the males, this prostatic enlargement, which we call it as BPH, the benign prostatic enlargement, or because of the cancer also, it can also be the common cause of overactive bladder symptoms. Then, if you talk in the females, the common etiologies in females are urinary tract infections. And with age, what happens after the age of 40 to 50 years is there's a menopause happens. So with the menopause, there are hormonal changes in the body which leads to changes in the mucosa of the bladder, urethra, and the vagina. So these all these reasons they combine and cause the overactivity of the bladder.
Okay.
Then after the age of 40 to 50 years, another important risk factor comes into play in females, especially, which we call it as weakness of the pelvic floor muscles. These pelvic floor muscles are the muscles which support your pelvic organs, including the bladder, urethra, the vagina, uterus, as well as the rectum. So when these muscles they become weak, there's a condition which we call as pelvic organ prolapse. This also can be the cause of overactive bladder, which is very common, underdiagnosed condition and untreated also.
Okay. So there can be different causes through which one can suffer from overactive bladder. And sir, how many times, like when the person is going to pass urine, how many times is considered as normal?
Usually 1 to 2 times per night. After the age of 40, we take it as normal. There is no such cutoff actually. Why? Because, for example, a patient who is at home, not working, and happy with the sleep, and not bothered about whatever time he is getting up in the night, it is okay. But if the person subjectively feels bothered about getting up in the night even twice, so it is considered significant. You understand?
So there can be different symptoms through which we can get to know that yes, we are suffering from overactive bladder. So sir, once the patient goes to the doctor, are there any tests which have been conducted through which we can get the surety that yes, we are suffering from overactive bladder?
Yes, Vashari. There are tests, but before we proceed, as a physician, as a urologist, before we proceed with the test, we need to examine the patient fully. We need to take the full clinical history from the patient. From this history, as well as the examination, we can cut down to the diagnosis, we can cut down to the underlying reason which is causing the overactive bladder symptoms. So among the history, we need to find out what is the drinking habit or the eating habit of the patient. What is the lifestyle? Whether he or she is taking a lot of tea, coffee, eating habit of chocolate, which increase the production of. Whether the person is taking too much or is habitual to alcohol, which also increases the production of the urine. Even some people have a myth that taking a lot of water will save their kidneys from disease in the later life. So they might be taking a lot of water for 5, 6, 7 liters. This also will increase the urine production and ultimately lead to the patient passing urine multiple times during the day as well as night. So once we cut down on the history, then we have to examine the patient fully. Examination includes the local examination of the genitalia of the local genital region as well as the urethral opening. Plus, we need to examine the patient from the neurological also, because many patients they have some neurological disorder. They might be suffering from cerebrovascular accident or paralysis. Underlying paralysis which they are recovering from. They might have a history of some sort of spine surgery or a surgery of the bladder or urethra in the childhood, which in the later life can also cause these symptoms. So history plus examination, then we come to the test. So if you ask me about the test, so the initial basic tests include basic uroflowmetry, in which we ask the patient to hold urine for till he or she has a sensation of passing urine. Then the patient has to pass urine on a specialized equipment. We call it as uroflowmeter. So this machine tells us the amount of urine passed and the pattern of the urine flow. So from that, we can infer the underlying cause also. It can suggest us the underlying cause also, and based upon this, the further test can be advised to the patient. Then the other tests include urine routine microanalysis, from which we can exclude or include the chances of UTI. If there are chances of UTI, we order a urine culture sensitivity test also. Based upon these tests, The ultrasound of the abdomen or the pelvis is plus minus, which patient may or may not need. And if ultrasound finds any abnormality, the patient may require some other specialized tests also. These are the basic tests actually. After these basic tests, history and clinical examination, a urologist can order, may or may not order the further specialized tests also. If you ask me about the specialized test, this includes a urodynamic study, which is a computerized test, computer-based test, in which the patient is there are tubes which are placed in the urethra and the rectum, and then the patient is connected to the computer, and the bladder is artificially filled, and the patient is asked to pass urine after a certain amount is gone into the bladder. So this test tells us about the functioning of the bladder, the urethra, and the sphincter, which holds the urine into the bladder. So these are the biggest tests which we usually order. There is one more test which I don't call it as a test actually, because this can be diagnostic as well as therapeutic. I mean the part of the treatment, so which we call it as a bladder diary or the voiding diary. This is actually a record of a patient which the patient has to keep for 48 hours to 72 hours at least. The record includes the type of fluid liquid the patient is taking throughout the day or the night, and the amount he or she is taking, and the time as well as quantity of the urine passed throughout these 48 to 72 hours. So from that record of continuous 48 to 72 hours, your urologist will come to know whether it is only because of increased intake of water, increased intake of drinks which increase the production of urine. So this is very useful, and the patient also can see it, and patient also can understand that what type of liquids he or she is taking and what amount he or she is taking, and that way it will also help the patient to understand and take part in the treatment also positively.
Definitely, sir. So once we get to know that yes, we are suffering from overactive bladder, what are the possible treatment options through which one can get rid from this problem?
Right. Now, as we come to the part of the treatment, as we have discussed, there are various reasons, various causes, and the treatment of the overactive bladder symptoms depends upon the underlying cause, obviously. So, for example, if the underlying cause is just the increased water intake, increase, intake of caffeinated drinks, for example, tea, coffee, chocolates. So, the treatment, number one, and the most important part of the treatment will include the lifestyle modifications. Among the lifestyle modifications, we tell the patient, we counsel them to, cut down on the intake of liquids, stop taking or avoid taking the carbonated beverages and like Pepsi, Coke, and carbonated drinks, and avoid taking alcohols and tea and coffee. And plus, there are we also tell the patient to take the liquids according to certain times of the day. For example, the patient who is passing urine, especially in the night, only multiple times, we tell the patients to stop taking or avoid taking liquids after 7 to 7:30 p.m. in the night. And once they go to the bed, they need to pass urine or they need to empty the bladder fully. Then they go to the bed. And multiple times the patients have a habit, as a general public person, they have a habit to, when they get up in the night to pass urine, they pass urine, come back to the bedroom, take another glass of water, and then go to sleep. They should avoid doing that. So the first line of treatment would be managing the lifestyles, liquid intake, type of liquid intakes. So this forms the first part, and this should be advised to each in every patient who is suffering from overactive bladder, whatever the underlying cause is. Then comes the specialized treatments. Specialized treatments include, for example, if the patient has a urinary tract infection, we need to treat the urinary tract infection with the antibiotics, depending upon the urine culture and sensitivity reports. If a patient has some anatomical or pathological problems, they require treatments accordingly. For example, patients having bladder stones, kidney stones, or urethral stones, the stones need to be moved. Patients who have urethral strictures, I mean the tightness of the out passage of the bladder, urethra, the stricture needs to be handled. If a patient, male patients, they have prostatic enlargement, if you treat the prostatic enlargement, their symptoms of overactive bladders are usually treated. Prostatic enlargement may be treated with medications or with surgery. Both will lead to treatment of the overactive bladder symptoms. Then, if the patient has some underlying neurological problems because of which they have bladder issues and they need treatment according to that. Many patients, they are habitually constipated, so they need treatment of the constipation, the bowel management, along with the management of the overactive bladder symptoms. Once these stepwise measures are taken, the residual symptoms are treated with specialized medications, which are broadly categorized as bladder relaxants. There are a variety of treatments available. The earlier treatments, they used to have a lot of side effects. The constipation, headache. These were the hypertension. These were the most common symptoms we used to have with the previous old medications. There are a lot of newer medications which have come up, and your urologist will decide according to your profile, your clinical profile, your blood pressure, your age, and your family background, which medication to be prescribed. And these medications, they are to be taken usually for a longer period if there are no underlying risk factors.
Okay. So, sir, there are many treatment options available for the patient.
These medications can be.
Okay. Sir, am I audible?
Yes. I can hear you.
Okay.
Yes, Vasha. Please go ahead.
Yes. So we were discussing about different treatment options that are available for the patient through which they can get rid from this problem. So from this, we have got, sir, one question from our viewer, and this is from Pratham Singh. He's asking, are there any dietary habits which help in preventing overactive bladder?
Yes, Pratham. The dietary habits basically are, for example, if you are taking a lot of liquids, you are habitual, you are addicted, or even the social drinking to alcohol, they increase your chances having overactive bladder symptoms. If a person is taking a lot of, for example, the office goers, the businessmen, they have a habit of sitting in the office and taking a lot of coffee, 6 to 8 cups of coffee per day. So this increases your chances of overactive bladder symptoms. Smoking is another risk factor which causes smoking-related cystitis and leads to the symptoms of overactive bladder. So if you avoid such eating, drinking, or smoking habits, you are already cutting down your chances of having overactive bladder. Plus, another thing I would suggest you is daily routine light exercise. Performing some yoga also has been seen to reduce the chances of having overactive bladder.
So, sir, as you have mentioned that drinking a lot of cup of coffee or tea is not good for health. So, how many cups of coffee we can take in a day? That is considered normal.
I usually take 2 cups of tea, one in the morning and one in the evening. Evening coffee, evening tea, I usually take by 5 to 6 so that my night goes well.
Okay. So having 2 cups of coffee is still okay, but more than that should be reduced. This is for all the viewers who are listening to us.
Right.
So taking the next question, and it is by Jay. He's asking, sir, what are the side effects of long-term medication that we take for OAB?
See, long-term medications, because these medications are usually classified as bladder relaxants. How do they relax the bladder? They act on certain sort of receptors, neurological receptors in the bladder, which lead to relaxation of the bladder muscles. However, the problem is these receptors are there in other organs of the body. And most commonly, they are there in the nervous system, they are in the brain, spine, and the neurons of your intestine. So what happens with the common side effects which happen with these medications is constipation, which is very common. Headache, many people have. These are the common symptoms. With the newer drugs called mirabagrone, these side effects are very less. However, another side effect with them is rise in BP. With the long-term medication, the BP tend to increase. So hypertension is another common side effect with the newer medication.
So, sir, for these side effects, what is the solution? Should we stop taking the medication, or there is something else that we could do?
There are what we usually tend to do is, for example, I told you the constipation is a very common side effect. So until unless it is difficult for the patient, we tend to continue with the medications, because the overactive bladder symptoms themselves, they are very troublesome for the patient to cope up with their daily activities. They tend to hamper their daily activities. The patient is afraid, especially the females. They tend to afraid of their home. They tend to visit family functions because of these symptoms. And if the leakage is there, then it is compounded. So we tend to continue with medications. However, we may or may not need to add some medications to take care of the side effects of the medications. For example, the constipation is a common side effect. We may add some laxative to to these medications, so that the patient's intestine or the bowel is taken care of. He or she should pass urine, evacuate their bowel daily once, and then tell them to give them advice on the dietary advice also. They should add a lot of salad, fruits, and green vegetables in their diet, so that the constipation is avoided. However, sometimes the side effects are unavoidable and not bearable by the patient. Then we need to stop the medication. We need to change the medication, and sometimes changing the brand also may help.
Okay. So yes, the side effects are there, but there is nothing to worry. The solution is also there. So all the things that which have been mentioned in this live needs to be taken care of. This is for all the viewers. So, sir, in the end, what would you like to suggest to all the viewers who are listening to you so patiently and trying to understand about overactive bladder?
Yeah, this is a very important part we have come to. See, this bladder wellness program which you have initiated is a commendable job. So what I want to tell the general public, my patients, everybody actually, that please do not ignore these urinary symptoms, because, for example, the frequency, the urgency of passing urine, or multiple times getting up in the night to pass urine, please do not ignore these symptoms. What happens in our country, in India, what happens is, after a certain age, the patient or a layman would tend to attribute these symptoms to advancing age. However, what I personally believe is, your comfort should be more with the advancing age. So you are comfortable 40, but be more comfortable when you have crossed a certain age of 50. So if you are symptoms, please do not ignore these symptoms. Please visit your urologist, your physicians, who will guide you properly to with the test, examination history, and then if you need some treatment, you can start that.
Certainly. So once again, thank you so much, sir, for such a valuable session. It was really indeed very much informative for all our viewers. Thank you so much, sir, for taking out time and telling us about overactive bladder.
Thank you very much. Thank you very much.
And thank you to all our viewers for being so patient and listening to us and trying to understand about overactive bladder. We'll see you all soon in the next session. Till then, you can follow us on our FB page. You'll find us by the name of Bladder Wellness. You can also follow us on YouTube, Twitter, and Instagram by the same name, that is Bladder Wellness. This is your host, Varsha Shrivastava, signing off. Take care, everyone. We'll see you all soon. Thank you so much.